I first got the COVID vaccine the day it arrived to Baton Rouge. I was fortunate enough to be able to be one of the first people to get this vaccine. It was pretty much like any vaccine I'd gotten. I would compare it maybe to the flu vaccine. It was given in my arm. My arm was a little tender that night, but other than that, I really didn't have any symptoms. My patients ask me a lot about the vaccine. They want to know if I have received it. I let them know I was one of the first people to receive it. I explained to them why I received it, why I think it is important for them to receive it. I also tell my patients to speak to their healthcare providers, speak to their physicians to see if they are a candidate. Some people may not be a candidate for this vaccine, but most people are. I do encourage those patients to get this vaccine to help protect themselves against this virus. I believe it was very important for me to get the COVID vaccine because I am a healthcare provider. I'm a physician. I see patients every day, all day long. I have constant exposure to patients, including any person that could possibly be carrying the virus. In addition, I am a type 1 diabetic, so I have a comorbidity that could also lead to potential problems if I did develop this virus. So I thought for those two reasons it was very important for me to get the vaccine. So my advice to my cancer patients are to get the vaccine. Most medical oncologists are allowing their patients to receive this vaccine even while they're getting chemotherapy. I would always encourage them to speak to their medical oncologist or the person giving them the chemotherapy first. But again, most of these cancer patients are candidates for this vaccine. They're, again, can suffer comorbidities associated with getting this virus. They're one of the patient population that is so critical in getting this vaccine. I have several patients that are hesitant to get the vaccine. They often have seen things on social media, heard things from their neighbors, heard things from their family members, and possibly are discouraged or are frightened to get this vaccine. I tell those patients to learn the data, look at the data, talk to their physicians, talk to their healthcare providers. If they are a candidate for this vaccine, they do need to get it. I will tell you that again, most of the information that they have heard, those that are frightened, are not necessarily accurate data. So make sure if you're looking at information about this vaccine, it is truly from a good, reliable website. It's from a good, reliable healthcare source such as your physician. And I do encourage them to get that vaccine. A lot of people are frightened because they've heard from someone that they know that had a reaction to this vaccine. A person can have a reaction to any vaccine, not just this COVID vaccine. But most of the side effects associated with this vaccine are mild. Again, I keep on comparing it to the flu vaccine. Most people will just have a little tender arm. Some people feel a little fatigued, a little tired towards the end of the day. But again, I believe most of the people that are experiencing side effects that pretty much everyone gets from most vaccines. I think it's so important for physicians and healthcare providers to be out front in getting this vaccine because, number one, we're exposed to patients every day. We're potentially exposed to this virus every day, so we're putting ourselves at risk for developing this virus. Now, that being said, if we're protected against it, this vaccine is very efficacious. If we're protected against this vaccine, it'll allow us to be able to continue to take care of our patients without becoming ill. It's also very important because physicians are a role model for our patients. Patients look to see what we are doing. If they see that their own physician received this vaccine, I believe that will encourage them to do the same. If they're talking to their physician and they realize their physician had minimal side effects associated with receiving this vaccine, they're going to be much more willing to do it themselves.
I got the COVID vaccine. Actually, Women's Hospital started vaccinating the healthcare providers and staff on a Wednesday. I was one of the first people to actually obtain the vaccine. So it was a very easy process. I signed up just like any other person would nowadays, and I came in at the time, my allotted time, and I got the vaccine. When I got the vaccine, it was basically just a little prick. I barely felt it, and I had no side effects from it. I had a little bit of soreness at the injection site for about a day or so, but that was it. When I received my second dose, I still had no side effects. It was important for me to get the vaccine because I did not want to get the virus, nor did I want to transmit it. So because the vaccine is safe and effective, I knew that that would be one more tool that I had to hopefully not have to deal with the coronavirus. And even if I got the vaccine, the virus, the severity of the illness would not be so bad. My patients' number one question to me, how was it? Because they know that I've been vaccinated. And I am elated to tell them that I had no problems with it. I want my patients to know that in order for us to rein in this virus, we all need to get vaccinated. We still need to socially distance. We still need to wash our hands. We still need to wear our masks, nose covered. And because we all want to get back to our normal lives. If you are hesitant about the vaccine, remember, it is the right thing to do. It is the right thing for you, for your neighbors, for your family. Please get the vaccine. You will be fine. It is safe and effective. It is important for doctors and healthcare workers to be out front because we are trusted. Our patients, our family members, our neighbors, they trust what we say. And that is a big burden for us. So we want to always try to say the right thing. We want to know what the data is so that we can have a lot of knowledge to impart upon our patients and our community. It's important for the Black community to get vaccinated because we are disproportionately affected by the virus. We are 3 times more likely to die and 4 times more likely to be hospitalized. So we really want our this vulnerable population to be vaccinated.
I received the COVID vaccine when it was available the first time back in December, the week of the December 14th, and received a second dose as well. And I had very minimal, or if no, symptoms basically. I did not feel any issues, no fevers, no major problems with the vaccine. When I received the second dose vaccine, I got a little bit of soreness in my shoulder, but that was it. No major symptoms, no fevers. I know that there's a lot of people that have some side effects from the vaccine. The majority of the patients that received the vaccine develop some fevers and generalized ache, but it doesn't last more than 24 hours. Well, I tell my patients that, first of all, the vaccine is safe. The technology for the mRNA vaccines have been around since the 1990s. And it's never been put in production for many reasons, and one of them being financial obstacles because it's a little bit more expensive. But basically, it's been around since the 1990s. It's been very safe. It's been tried before. And now with the pandemic, with the COVID-19 pandemic, the studies show that it's extremely safe and has very minimal side effects. The questions I get from the patients are regarding the vaccine are, is it going to cause some infertility or problems with miscarriages? And that's a myth. We know for a fact that the vaccine does not cause any infertility issues. There's some myths out there, and the misinformation is, significant. It's running rampant in social media. And there are some people that claim that the protein that the body develops as an antibody causes a detachment of the fertilized egg in women's uterus. But that's not true. That is a myth. And unfortunately, the misinformation out there, people try to mix fact with fiction, and it creates a lot of confusion. And I'd recommend for the patients to speak with their providers people who have knowledge of this and get more information from them instead of listening to social media posts or any kind of non-verifiable sources. I hear from patients say that you will get paralyzed if you get the vaccine, that you will get actual COVID from the vaccine, and it's not true. None of those claims are true. The studies, the preliminary studies, especially with the Pfizer vaccine, they did 43,000 patients, and almost none had any issues. There were some allergic reactions, understandable. Every medication or every vaccine that we administer has a potential causing reactions, and it's not mainly related to the actual vaccine. Is probably the components of the vaccines. It's not okay to wait. So we know that the state and the federal government has been giving us guidance on how to proceed, who do we vaccinate. So when your turn comes, I recommend everyone to be vaccinated because if you wait, you never know when the next round of vaccines are going to come available for you. And the only way that we're going to get out of this pandemic is wearing masks, social distancing, and getting the vaccine to create herd immunity. The importance of getting the two vaccines is to create immunity in your own body, in your own immune system. So the first vaccine starts that process, right? But that doesn't mean that you're not free from getting COVID. After the second dose of the vaccine, actually 10 days after the second dose, is that we know that the body develops immunity to the virus. So we recommend that even though you get the first dose of the vaccine, not to relax the COVID safe measures, because we know that people can get the infection after the first dose of the vaccine. Not from the vaccine, but from being exposed to other people with COVID.
I got my first vaccine, I believe, on December 14th, and I was very excited to get it because I have seen so much death and destruction from COVID. I'm 66 years old, and I'm in a group that has the increasing rates of complications for COVID, and I've been taking care of patients since the pandemic has begun. I had very few side effects, if any, a sore arm, didn't even need to take a Tylenol. On my second vaccine, I took the Pfizer vaccine, which was 3 weeks later. I took the regular strength Tylenol because of a little soreness and achiness, but that resolved within about 4 to 6 hours. Well, the first thing I do is I ask all of my patients, I'm a cancer doctor, have you had your vaccine? So currently the state allows patients over the age of 70 to receive the vaccine. I know of no reason why a cancer patient should not receive a vaccine. Cancer patients have been found to be very susceptible to the effects of COVID. There's an increasing chance of dying from COVID, of being hospitalized from COVID, and I strongly, strongly urge all of my patients to take the vaccine as soon as they can get the vaccine, wherever they can get the vaccine. The majority of patients that I see have already scheduled their vaccines and have taken them, or in the process of being immunized. There are some people who have all sorts of questions about the vaccine in terms of not really understanding how the vaccine was created. They're very skeptical because it was created so quickly. They don't understand the science behind that. I think a lot of it has also become very politicized, where this virus is not a political animal, it's a virus. And we have to fight this, whether you're a red state, blue state, Republican, Democrat, or independent, it makes no difference. The virus doesn't care. And we have to separate ourselves from that and recognize that we have an opportunity to develop immunity as a community to drive the ability of the infection to go down so we're not ravaged by the infection as we are at this time. I took the vaccine as soon as I could. My mother's taken the vaccine. My mother-in-law is taking the vaccine. My wife is constantly asking me when can she get the vaccine because she's too young for it at this point. But I think it's very safe. I have no questions. My daughter, who's a physician, got the vaccine when she was 38 weeks pregnant, got her second vaccine, nursing her grandchild. And so I do not have any concerns over the safety of the vaccine. I know of no reason why someone would feel that from a religious standpoint to not take the vaccine. Now, there have been questions raised about how the vaccines were developed. The two vaccines that are licensed currently in the United States, Pfizer and Moderna, have both been looked at from the United States Catholic bishops, and they both are felt to be no evidence of embryonic stem cells were used in their development. If you go on the U.S. Catholic website, there's a strong statement in that regard. I don't understand why someone would not want to be vaccinated, because by not being vaccinated, you have the potential of exposing other people to this vaccine, to this disease. You may not be sick, but you may bring this home to a father, a mother, a grandparent, someone who is ill. And to be honest, we don't completely understand why some people develop very severe illnesses and why some people don't. So you really you could potentially harm other people by not being immunized. One of the things that we've done at Ochsner is we were one of the early sites for some of the monoclonal antibodies to fight the disease. We have access to drugs that can be given to people who have already developed COVID. If we can get these drugs into people early, we can dramatically decrease their chances of ever needing to be hospitalized, and if they don't need to be hospitalized, them ultimately not having complications from COVID. If someone is 70 years of age and they develop COVID, there's a 20% chance they will be in the hospital. If they're one of those 20% in the hospital, there's about a 10% chance they'll die from COVID. What we're doing here is we're giving a medication to people who are at a high risk based off of age and other qualifications to actually decrease their chances of ever being hospitalized. It's truly dramatic what we've been able to do for many of our patients.
I got my first COVID-19 vaccination administered about 6 weeks ago, and my second administered about 3 weeks ago. I had very mild symptoms from my vaccines and a very small price to pay for great protection against the COVID-19 infection. I'm certainly exposed to patients with COVID-19 on a daily basis and continue to see patients on a daily basis that could potentially be infected. So for all healthcare personnel, it's so important for all of us on the front lines to be protected against this terrible infection. I would say that the side effects that I had are very comparable to what I normally get with my yearly flu injection. They were temporary, they were mild, and again, a very small price to pay for a lot of protection. Amongst my cancer patients, I get a very large number of calls, as probably all oncologists are getting right now, as to the safety and also the efficacy of the vaccination. We are certainly advocating that all of our patients receive the vaccine when the vaccine is available to our patients, and we know that it's not only a potential excellent safeguard for our patients, but we also know that it's extremely safe. We're getting a lot of questions, and hopefully through multiple media that we are appealing to, we can get the word out that yes, we are recommending for patients who actively have cancer and those who are actively undergoing treatment for their cancer should absolutely be vaccinated when the vaccine is available for each patient. It's very important that any patient with an active cancer or who is actively receiving treatment for their cancer speak with their oncologist one-on-one to make sure that it is recommended by their own treating oncologist as to the safety of receiving the vaccination. It's very interesting in the setting of treating cancer patients that cancer patients have an amazing understanding of their susceptibility to infection. So we have actually not seen a significant increase in COVID-19 infection amongst patients who actively have cancer, probably in part due to the fact that cancer patients know the safeguards in which to take of cleanliness, hand washing, social distancing, and we're probably doing that to some degree even before we knew these terms for COVID-19 infection. As loved ones and caregivers for patients, who have cancer and who are actively being treated for cancer have the opportunity to receive the vaccine. We're also advocating that all people who also care for patients with malignancies should get the vaccine when it is available. That's because we also know that we need to protect potential carriers that could bring COVID-19 to our patients by close proximity should also be protected. We're not very certain that the vaccine absolutely protects a patient from being a potential carrier for the virus, but we do believe that that risk is certainly reduced. So it is very important that all those who are caregivers for patients with cancer should be protected through the vaccination also. We fear at this point that cancer screening is actually down because of patients' fear of entering a medical facility to get normal, standard, age-appropriate cancer screening. And we believe that we're actually seeing some instances where patients are presenting at later stages of their malignancies because of the fact that they are not seeking appropriate, age-appropriate cancer screening. We urge all patients to continue their routine screenings, especially at facilities like hospitals that are taking all necessary precautions to protect people who are coming into the facilities against COVID-19. We know it can be really concerning for a patient to come into a medical facility where patients with COVID-19 are actively being treated, but that should not be a deterrence to a patient actually still concentrating on their preventive health care. What we know is that the vaccine absolutely protects a patient from getting a severe illness with COVID. What we're not certain is if the vaccine absolutely makes a patient not be able to carry the virus to another loved one. So it's important to get the vaccine for that reason, but it's still very important to continue what we're doing for protection, social distancing, masking, and extreme concentration on hand washing.
I think it's very important for as many people to get this vaccine that are candidates for it as possible to be COVID safe. We have had such changes in the world around us, from wearing masks to social distancing. A lot of people want to go back to the way that used to be, some normalcy. Now that being said, I do encourage people who have had the vaccine to continue safety precautions. They need to continue to wear their mask. They need to continue to practice social distancing. But that being said, the more people that get this vaccine, the more COVID safe the environment around them is going to be.
It is very important for people to be COVID safe because we don't want to overwhelm the healthcare system. If we, on top of the regular patients, if we see a surge of patients coming in to take care of their COVID issues, that's going to be very drastic to the manpower, to the staff, to the ability to host patients in our hospitals, because we are seeing a significant increase on not only on COVID patients, but on non-COVID patients as well.
It is important for everyone to get the vaccine to be COVID safe because we want to rein in this virus. We have to fight this pandemic. It is getting worse. Our numbers are still high, and we have new variants. So we want to do everything. We have to do it for each other, for each other's family members, for our older population. We are doing the right thing by getting this vaccination.
To become COVID safe as a community, we have to look at this in several ways. Number one, what we do daily: wash our hands, wear a mask. I wear a mask all day long when I'm in contact with other people. I ask my patients to always mask when they're in the room with me, no exceptions, period. Number two is in the long-term way of becoming COVID safe is that we all become immunized. By immunizing us, we will develop herd immunity. That is, the virus will have no place to go because everyone will be immunized and the virus will die away. And so that's what we need to do to become COVID safe as a community. We are truly all in this together.
It's important for all of us to participate in initiatives such as COVID Safe, because the only way that we can control this virus is if we do this as a complete society. So vaccination, but until we have the entire community vaccinated, continue to concentrate on our efforts for social distancing, for masking, and for hand washing, which is the best things that we can do to stop the spread of this virus.
A mis amigos hispanos en la comunidad, les recomiendo que cuando su turno para la vacuna llegue, por favor, procuren vacunarse. Es la única manera que vamos a salir de esta pandemia. También les recomiendo a nuestros hermanos de la comunidad hispana que por favor mantengan el distanciamiento social, mantengan las medidas de COVID Safe, como usar máscaras y mascarillas y evitar reuniones de más de 10 personas. Lo más recomendable que yo le puedo sugerir a los hispanos de la comunidad es que se mantengan con las personas que viven en su casa y no salgan a reunirse con otras personas.